Good morning, everyone. Myself, Dr. Harsimran Kaur, Senior Research Fellow at CBOIT, PGI Chandigarh. It's my immense pleasure to welcome all the participants for today's session. I heartily welcome our speaker, Dr. Shikha Shukla, our Principal Investigator, Dr. Varinder Garg, our co-PIs, Dr. Harish and Dr. Sakshi, and all the coordinators from the Brain Trust Institutes. Today we have a session named by non-communicable diseases in India, its trends and strategies for prevention. Before we start the session, I would like to play one video of CBOIT.
Thanks for watching this video. Now, I'm introducing our speaker, Dr. Shikha Shukla. She's a public health expert and CEO of Health Karma, New Delhi. With over 16 years of professional experience in healthcare sector, ranging from AIMS to working with different central ministries, state governments, international organizations, development sectors, and the pharmaceutical industry, Dr. Shikha has led various public health programs at the national and state level, contributing to the National Sustainable Development Goals to improve health outcomes. Her core expertise lies in the area of public health policy advocacy, health system strengthening, strategic management, health research, and monitoring. She has made an outstanding contribution in the area of non-communicable diseases, mother and child health, adolescent health, and nutritional issues. She holds a doctorate in public health and has published various research papers, articles, and policy papers on different healthcare issues. She has also received various accolades and appreciation for her work in different capacities. We welcome you, ma'am.
Thank you so very much. First of all, a very good morning to all of you. And I'm very much thankful to CBIOT for inviting me for this discussion. So without wasting time, I think let us start with the session. So let me just share the screen with all of you. Let me know when it's visible. Is it visible?
Yes, ma'am.
Okay, just a minute. Is the screen visible to everyone?
Yes, ma'am.
Yes, ma'am, it's visible.
Okay. So thank you so much once again, and let us understand first of all what are non-communicable diseases. And before starting up with this entire discussion journey, I will be talking about what are the policy landscape that is available, and along with that, understanding what is the prevalence and what are the other areas wherein India has taken a lead forward in terms of the policy formulations for non-communicable diseases. Along with that, we will understand what are the government initiatives and programs that are existing, specifically targeting to different non-communicable diseases. And then we will be talking about how we can increase the access to sustainable non-communicable disease treatment and care, and definitely talking about what should be the recommended actions to move the agenda of non-communicable diseases. So before we take this journey, let us try and understand that what are the policy level implications. So as we all know, that India being a member state of UN has already adopted the SDG agenda in the year 2015 to accomplish it for the year 2030. And according to this agenda, all the member states have to achieve the targets in reference to the various global indicators by 2030. That means that we really aim to reduce the 1/3 premature mortality from non-communicable diseases. And along with that, we really need to achieve the universal health coverage, including the financial risk protection, as well as access to quality essential healthcare services. And of course, having a safe, effective, quality, as well as affordable essential medicines for all. And with this, there has also been a national policy wherein, India has already taken up a lead by adopting the WHO Global Voluntary National Communicable Disease Targets, and as well as NCD monitoring framework, wherein an action plan has been formulated in order to reach out to the 17 sustainable development goals by the year 2030. And thereby, if we have to really adhere to these time-bound national NCD targets, there is definitely a need of strong surveillance on NCDs, which really seems to be inadequate. Now, moving forward, let us understand what has been the prevalence of non-communicable diseases. So as we all know that, non-communicable diseases really pose a threat to the public health, and therefore it calls for an international action for prevention and management. And if we see globally, more than 36 million of people die just because of non-communicable diseases, and out of which 14 million people die before the age of 70 years. So talking about India specifically is also moving towards this transition, and therefore surpassing the burden of communicable diseases with more and more increase in the number of non-communicable diseases. And as per the report also, it highlights that 65% of all deaths in the countries attribute just because of non-communicable diseases in India. And with the recent report of which is of Health of the Nation report, and this was the report which was conducted basically by Apollo Hospitals, also showed an increase in the prevalence of diabetes, especially in the southern and eastern belt of India. And also it indicates a national prevalence of diabetes of around 7% and over 8% in case of hypertension. And similarly, around 2% for COPD as well as asthma. Now, considering this population of around 1.2 billions in India, there is all a huge need that we really need to see to it that that there is possibly a reduction in the non-communicable diseases, and therefore we must address the NCD challenge through targeted interventions and must approach health as an investment and not as an expenditure. So if we see, there are a lot of other data which are also available, which do happen to conduct some of the surveillances and do indicate the prevalence, whether it is the National Family Health Survey, or even for that matter, there are Global Adult Tobacco Survey, India Diabetes Studies, as well as there is also one of the study which is on longitudinal aging study in India, which is being conducted. But all of these studies lack in providing a complete NCD, national NCD risk factor profile, which really makes it important that we must have some sort of an NCD monitoring framework in order to accelerate the agendas of non-communicable diseases in India. So moving forward, we have a national health policy, which really focuses on the growing burden of non-communicable diseases and the growing incidence of unsustainable expenditure for health. Now, with non-communicable diseases, if you see, the shift has been focused more towards onto the wellness and also allocating 2/3 of the total resources. So there is an increased allocation in the resources, and also the government plans to basically increase the GDP also from 1.3% to 2.5% in order to reduce the premature mortality, which is caused by non-communicable diseases, to 20% by the year 2025. And all this will be possible only because if we have availability of free drugs, free emergency care services, as well as free diagnostics. So in order to push the agenda, which is also there very much highlighted in the national health policy, we really need to understand what are the current programs and how we can further strengthen these programs through targeted interventions. So before we go ahead and understand what are the government programs, there is also an understanding of to understand what has been the economic impact of the rising cases of non-communicable diseases in India. So if we see, the global cost of non-communicable diseases also expected to, rise for more than 20 trillion USD, out of which 45% would be due to the productivity loss, either from disability, premature death, or even absenteeism. And if we see the economic burden of NCD, then it varies from state to state. And if we see the case of Kerala, which is mounting to as much as 20% to its state domestic product, then we can clearly say that still we can manage it, because more than 80% of these non-communicable diseases can be prevented if they are early diagnosed and therefore managed through effective preventive strategies. And similarly, there is also one of the recent data which highlights that nearly, if there has been an increase of 72% in the number of medical insurance claims just because of NCDs, if we see the trend from 2016 to 2019, and with an average claim of 1 lakh to 1.2 lakh, leading to increase out of pocket expenditure. And similarly, in one of the healthcare systems of Tamil Nadu, you can clearly see that, the out of the cardiology packages which are offered as part of the state insurance program, 25% of these total claims are utilized by the cardiology. So the idea is basically to make you understand that, whether if we talk about the different non-communicable diseases, then definitely there has been a much higher economic consequence that have been leading just because of different NCDs. And yes, WHO has already estimated that even if there is a 2% annual reduction in the national level chronic disease death rates, then definitely there will be a gain, economic gain of USD 15 billion for the country in the next 10 years. So we really need to think about on those directions, that how we can reduce the economic consequences of these rising cases of non-communicable diseases. Now, let us move forward and understand that what are the government initiatives to tackle the non-communicable diseases. And with this, I would like to tell you about one of the main program wherein even I was part of it while I was working with the Ministry of Health and Family Welfare, and wherein we came up with the program on National Program for Prevention and Control of Cancers, Diabetes, CVD, and Stroke, which is also called as an NPCDCS program. And this program basically aims to strengthen the infrastructure, human resource development, and also strengthen the screening, management, monitoring, as well as capacity building of the frontline functionaries, as well as healthcare providers through public-private partnerships as well. And for this program, e-funds are provided to the state governments under the NCD Flexi Pool through the state PIPs. And for this, the ratio is 60:40, which means the 60% is being provided by the central ministry and 40% is the state share. While for the northern, east, and hilly areas, the state share is 90:10 ratio. Now, talking about this entire program, so far there has been a lot of capacity building programs which has happened, and you can very well see the data, which is of September 2021, that highlights that more than 5 lakh ASHAs and over 1 lakh ANMs and other multiple purpose workers, along with that other paramedical staffs as well as medical officers, have already been trained on universal screening of common non-communicable diseases. And this has a major component specifically right from setting up of the NCD clinics at the CHC level as well as the district hospital, to putting up or setting up of CCUs and daycare centers, along with that, or having the cancer chemotherapy centers, as well as strengthening of the tertiary cancer care centers, has already been a plan of the government of India. And also there is a much more focus on the health promotion aspect of it, wherein there is a much more levels of interventions that are planned for increasing the community awareness through the engagement in various health function celebrations, as well as establishing the linkages for an accessible, high quality treatment at an affordable rate. So with this, there has already been a major program that I've talked about, and there are a lot of other components onto it, but the major components lie specifically on getting the early detection. Now, there are other programs also which are there, and when we talk about because non-communicable disease is a wide umbrella. So under this, there is one program which is again on the national framework for joint tuberculosis diabetes. And under this, there has been a national strategy which is being developed for increasing bidirectional screening, early detection, and management of TB as well as the diabetes comorbidities. Since there have been a lot of cases of diabetics having higher incidence of TB, so therefore there has been a specific strategies which is being developed by the Ministry of Health and Family Welfare to accelerate this particular agenda. Similarly, a lot of comprehensive, primary healthcare is also being set up through integration of NPCDCS as well as the National Urban Health Mission, wherein the idea is to promote as well as manage non-communicable diseases targeting to the urban areas. Then one of an interesting program which is being led by, in partnership of ICMR and Ministry of Health and Family Welfare, along with the state governments and WHO, is the India Hypertension Control Initiative. Now, this is one of a unique program which is being implemented in 87 districts of 18 states currently, and deals with the 5 critical components, right from the developing of the standard treatment protocols to ensuring continuous medication supply, as well as patient-centered care and strengthened monitoring and evaluation system to ensure follow-up and patient tracking. Now, with this, initially when I was there with the ministry, so the focus was right only on the NPCDCS, but as and when there was a lot of data that started coming up, and it was realized later on that COPD is also increasing a lot. And with this, the Ministry of Health and Family Welfare also came up a program basically targeting on the prevention of chronic obstructive pulmonary diseases, which is again an operational guidelines were launched by the Ministry of Health and Family Welfare, focusing on early detection, management, and appropriate referrals for the COPD patients. And similarly, if we see that there has also been a rise in the case of, non-alcoholic fatty liver disease. And with this, again, as operational guidelines have been launched, specifically under the ambit of National Program for Prevention and Control of Cancers, Diabetes, CPD, and Stroke. And with this, if we see, the prevalence is also around 9 to 32% in India. So you can very clearly see, that the government is realizing that with the current, data that is getting generated, a lot of non-communicable diseases are getting added under the ambit of NPCDCS program. So when this NPCDCS program was initially launched, it basically started as an opportunistic screening, wherein anybody who wishes to get screened could have visited to the center and get it screened. But of lately, it was realized that there is a much more need to understand what is the true prevalence that is existing in the population, to understand the exact and true prevalence of non-communicable diseases. And with this, population-based screening initiative was launched for common NCDs by the Ministry of Health and Family Welfare, under which all the people above the age of 30 years were screened for various non-communicable diseases. And here, this was basically right from a community-based model to reaching out to the district hospital. I'll be talking about this aspect in detail in the next slide. And also there is a provision of strengthening of tertiary cancer care centers, wherein there is a one-time grant of rupees 120 crores for the state cancer institutes. Along with that, there is around 45 crores for setting up the tertiary cancer care centers, including the state share. And this is basically meant for the procurement of equipment and the building construction. So here is the basic outline to make you understand of what exactly happens at the grassroots level and how the population-based screening actually happens. So here, as we all know, that ASHA is one first person who has the direct contact with the community. So with this, through the awareness generation and through the home visits, they prepare the family folders, and under the families, they screen all the people who are above the age of 30 years. And this is done through community-based assessment checklist, which is basically a risk profiling to understand with the score. So now let's say if the score is more than 4, all those people are listed as the suspected cases, and then these cases are referred from the subcenters to the, these suspected cases are referred to the subcenter for getting the further assessments done. And then at the subcenter level, there are ANMs who do the assessments of these referred populations for their various parameters. And then from there, if they've been diagnosed positive, they are referred to the PHC level, and wherein all the medications and other diagnosis initiates at that level through the registration of these patients. Along with that, in case there are some of the further complications that are observed, then from at the PHC level, these patients are either referred to the CHC or the district hospital for further advanced diagnostics and case management. So between all this, there is a maintenance of the data recordings, and every follow-ups are also being taken care of. In order to ensure that the patients do adhere to the treatments. Now, moving forward, we've understood the population-based screening, and with that, there are other programs also which are being developed simultaneously, because if we see that non-communicable diseases require a lot of convergence also between the line departments. So, is there any question? Or the questions can be answered at the end of the session. Let me know. Hello? Hello? Should I move ahead?
Yes, ma'am.
Okay. So another program which is there is the National Multi-Sectoral Action Plan, wherein the major idea is to bring all together the like-minded departments as well as other ministries together to actually work on putting up the strategies to attain the NCD targets, which are mentioned in the National Health Policy of 2017 as well as the National NCD Monitoring Framework. And with this, 39 ministries and departments have come forward and together have identified some of the action points. Now, another program that I would like to talk about is which is the Pradhan Mantri National Dialysis Program, which is currently running in a public-private partnership mode in around 35 states and 557 districts. And so far, there has been a setup of 1,011 centers, and 6,858 hemodialysis machines have already been deployed. Until now, if we see 11.78 lakh patients have been benefited with these services. Another recent programs that you all must have heard about, the Ayushman Bharat, which basically targets to having an insurance, which is through PMJY, as well as the health and wellness centers. Now, the idea of putting up the health and wellness centers is basically the reforming all the sub-centers and converting them into the health and wellness centers, so that if we are able to manage most of the pressures that do exist at the time of the early detection, then a lot of management can happen at that particular level. So all the majority of the sub-centers have already been converted into health and wellness centers under this. And there are a lot of facilities and health checkups which are available at these centers. Along with the screenings, there is also a lot of promotion of wellness activities and targeted communications that do happen at these health and wellness centers. With this, despite of a lot of programs, there have also been few initiatives by the Ministry of Health and Family Welfare, and one of them includes the Health Minister's Cancer Patient Fund, wherein there is a financial assistance is being provided to all the BPL patients for getting their treatment at the regional cancer centers, tertiary cancer centers, as well as the state cancer institutes. Along with that, there is also a Rashtriya Arogya Nidhi program, which is which basically provides a one-time grant to all the people below the poverty line who are suffering from life-threatening diseases for getting the treatments at the government hospitals and institutions. So this has been all about an understanding of the current programs. Now let's take a quick look at the digital health interventions that are currently being practiced specifically to non-communicable diseases. And since now the government of India has actually is accelerating the agenda of the National Digital Health Mission, I think there is a lot more scope to accelerate and have some digital interventions in place in order to have an effective management of non-communicable diseases. So one of the digital application and digital interventions that has happened is one of wherein Dell Technologies and Tata Trust has, in partnership with Ministry of Health and Family Welfare, has put up an NCD application. This is basically an NCD for the NCD screening program. And under this, this mobile app features all the patient records, follow-ups and management, monitors the PHC, and also have a aids in quick enrollment of the patients. So till now, if we see, there has already been 80 million enrollments done and close to 13 million have already been screened using this app. Along with that, there is also one of the program which is eSanjeevani telemedicine. Now here, this program is operationalized in 28 districts, 28 states and 550 districts across 6,000 health and wellness centers, and is connected to 240 hubs, which are set up at the states in district hospitals and medical colleges. And day-to-day online OPDs are provided through patient-doctor teleconsultations that happen at these telemedicine centers. Similarly, another program, which is M-Diabetes, which is being developed by Ministry of Health and Family Welfare, and all the data under this specifically gets integrated with the national software for NCD service delivery under the CPHC, which is the Comprehensive Primary Health Care provision. And it basically aims to generate awareness, promote adherence to treatment, and inculcate healthy habits amongst the masses, with the special focus on the target groups. Similarly, very recently, Tata Trust is also getting in some designing and implementing of the digital life care solutions to national NCD program under the Ayushman Bharat Health Initiatives. So despite of, there is a well recognized effort, and the government is also putting a lot of efforts to put up and come up with digital initiatives. But despite of all these, there has been a lot of learnings, I would say. I would not say that these have become a failure, but definitely there is a much more scope to learn from these technologies that have been implemented. And if we see, the integration of the data becomes a major challenge at present. And also there has been other gaps which really needs to be addressed while we consider other digital health initiatives in future. So now, having understood the prevalence and also having an understanding of what are the government systems that are underlying and what are the major programs that are being led by the Ministry of Health and Family Welfare, still there are a lot of things that we really need to achieve to accelerate the NCD agenda. And one of them is definitely to improve or to increase the access to sustainable NCD treatment and care. Therefore, we really need to build up the opportunities wherein different partners and collaborations, strategic partnerships can be rolled out to see to it that what are the barriers that really needs to be addressed through these strategic partnerships. And let's have a look at those areas. So now when we are addressing, we really need to understand that what are the barriers, first of all, in terms of the care. So we've already discussed in the prior slides also that we see currently the GDP is very low, and then there is automatic, I mean, if we see the budget also, if we see the out-of-pocket expenditure also, it is really high when we see it towards the patient's level. And sorry. And secondly, with all the programs in place, there is still a lot of agenda that needs to be pushed, especially on the preventive aspect, and that focuses basically on the disease awareness part of it. Then there are issues in the supply chains, definitely, and also if we see there are still a lot of investment needs to be done in terms of the infrastructure, as well as having more number of staffs, skilled staffs, specifically to deal with the agenda of non-communicable diseases. And when we talk about the health insurance coverages, still, though the government has already, initiated a very excellent program, which is Ayushman Bharat, but still, if we see the missing, there has been the middle income groups have been missing from this health insurance program, and therefore a lot more, sustainable as well as good programs with proper health insurance coverages are required to accelerate, the increase in access of quality healthcare services. Along with that, we really need to strengthen the digital health capacities before we actually get the implementation of digital interventions into actions. So for this entire barriers, I mean, these are some of the highlighted major barriers that I've highlighted, but still there are a lot many others that that really needs to be addressed. And these can be addressed only if we have a targeted holistic approaches in order to achieve the universal access to NCD care. So right from the NCD capacity building, whether we talk about strengthening of the institutional capacities, or even for that matter, strengthening the research and innovations to newer drugs, as well as understanding what could be the innovations that can happen at different levels of healthcare to tackle these NCDs. Secondly, I think community engagement definitely is very important if we really have to promote NCD prevention and management services to the communities, and to the communities basically who are most in need. Third, having an availability to essential non-communicable supplies and distributions. Now, even for that matter, there are a lot of generic pharmacies that have now come up in place, but still the government really needs to focus on the quality of the medicines, and also ensuring access to innovative medicines for better quality of the patient's life as well as management. Fourth and important aspect is also having a sustainable NCD financing. Now, if from my work experience, it has been observed that despite of a lot of fundings that goes from the central state, a lot of innovations and are required at the state government's level also to basically accelerate prevention and management of non-communicable diseases. And with this, healthcare financing is now emerging as one of the critical factors to basically assess the economic burden of NCDs, and also to understand that what could be the best sustainable models that we can achieve for the prevention and management of non-communicable diseases. And lastly, talking about the strategic collaborations and partnerships. So definitely a lot of efforts needs to be driven, wherein multilateral institutions, governments, as well as the private sectors can actually increase the access through collaborative partnerships. So if we talk about increasing the access to NCD care and treatment, a lot of work is needed in order to improve the access by having affordable NCD medicines, having quality healthcare services, and also innovating through digital health, promoting self-care, and as well as promoting or strengthening the partnerships. Now, moving forward, I think, we really need to do a lot in the area of non-communicable diseases. And if we have to do something on this, then therefore, in line to the National Digital Health Mission, we really need to prioritize non-communicable diseases through having a look at the digital healthcare innovations. And also, before we implement any of the digital healthcare innovations, also try and understand what has been the learning if we are rolling out the similar programs, understand those challenges, and then address those challenges before we actually implement it, because that will help us to come up with a better technology and test and pilot it. So looking into those, first and foremost is definitely increasing in the reach and opportunities for delivering the healthcare needs. And for this, we really need to enhance the 3 A's, which is availability, accessibility, and affordability for delivery of quality services and benefits. Secondly, engaging the healthcare professionals on using the technologies. Now, a lot of technologies are in place, whether it is, putting up the predictive analytics or using artificial intelligence for the screenings, as well as following the algorithm-based screenings and looking and putting up a lot of standard treatment protocols in place. So these really can help. And thirdly, empowering the population. And this can be done through a lot of disease literacy and knowledge sharing. Similarly, a lot of work really needs to be done when we talk about research and development, and wherein we can do this having a detailed disease surveillance. And as we talked in earlier slides also, there is a much more need to have a lot of surveillances and data that really needs to be there. Now, if we have to talk about, let's say, on diabetes, we do have a lot of data on type 2 diabetes, but not much data is available on type 1 diabetes. And similarly, there are other non-communicable diseases, again, which really require a lot of data which is required to exactly know what is the prevalence, and then to understand what are the economic burdens that are basically getting raised because of these NCDs. And definitely testing the new models to deliver healthcare, whether it is on the telemedicine, coming up with the hub and spoke model. Now, talking about the hub and spoke model, here what we do is one of the key centers becomes the hub, and the other smaller institutes basically act as the referrals, and they become the spokes. And the services and the patients get referred from these spokes to the hub for getting the treatment and management. So such sort of models can also be tested. And definitely access to drugs is important, because until and unless we really do not have an effective mechanisms or reimbursement procedures in place, wherein there is an access to good quality medicines and effective medicines, then it won't be any use. And talking about when we talk about the digital, then definitely a lot of efforts are now required to have patient registries in place, which are enabled through smartphones, and also coming up and setting up of smart clinics. And and last but not the least, having a strengthened referral linkages. Now, when we talk about the strengthened referral linkages, there are a lot of already mechanisms which are set up in the community system, but we really need to see to it that what are those challenges and how we can address those challenges by strengthening the referral linkages, because even the many of the softwares which are already available have been not that much effective in strengthening the referral linkages. So we really need to work on that. And for that, I'll just give you an example of this to illustrate, and maybe, you as a group in work, and see to it that what could be the other strategies that can be really useful for strengthening the referral linkages. And with this, this is a general setup that you see in the basic government system. So wherein, there are ASHAs, ANMs, and we've already talked about that, how the movement of the patient moves from one level to the other level of healthcare. And with this, if we have to see, you can say that, different interventions can be planned at the different levels of healthcare. So one intervention could be, when you are just planning to see to it that how the number of, people are much more diagnosed in an easier and a quicker way, wherein maximum number of people at high risk gets identified by these ASHAs, and then they are referred to PHC and further to CHC or district hospitals for getting the treatment. Then secondly, obviously, a lot of capacity augmentation, as we already discussed in earlier slides also, that a lot of digital health activities and capacity building is to be there to in order to make the people efficient and also to adapt to the new technologies that can happen. And thirdly, when we talk about the awareness, so there can be a lot of digital inventories and educational materials available to the people in the form of videos and health kiosks. And we can also have health kiosks for screenings as well as for general awareness and counseling services, because in case wherein we already know that there is a shortage of staff. So even if, I have certain queries related to, or I wanted to have a general understanding of any particular disease, I can use those health kiosks to understand and get a quick information about these, about different non-communicable diseases. And therefore, there is also a need to form a technical advisory group, which can comprise of different stakeholders all together, meeting and then discussing about the strategies for the regular review of the program implementation. So these could be some of the steps or strategies that can be placed to strengthen the referral mechanisms through digital innovations. But certainly there is a much more room for you to see, try and test and see to it that how these digital interventions can actually accelerate. So many of these digital interventions have been tested not only by the government, but a lot of development sectors as well as corporates have come up with new technologies, whether it is in terms of, let's say, screening of diabetes, retinopathy through the use of fundus cameras, or even for that matter, a lot of efforts have been coming up through various digital innovations, either the use of predictive analytics for the screenings or even for early detection. So we really need to see to it that before we implement any of these technology, understand what is the barriers and what and will that technology will be able to address those barriers before we implement it. And once any of the pilot has happened, there are a lot of learnings that do happen, and post those implementation, it is always good to adapt those learnings and see to it that, whatever modifications can be done into those digital repositories to make them more effective. So there can be a lot of variations and all that, but definitely there is a lot of scope wherein we can think in terms of the digital medium and or the platform to be used. With this, I would just say in the end that alone we can do a little, but together, if we aim to achieve, aim to achieve, then there is a lot more that we can really achieve through collaborations and partnerships and working as together as not in silos, but yes, as a teams, or maybe more and more towards the strategic partnerships. So thank you so very much. And if you have any questions, I'm happy to answer them. Thanks.
Any questions? I request all the participants, if they want to ask any questions from Dr. Shikha. Anyone?
I could see some of the hands.
Yes. Yes, Ravindra Kaur Talwar, you can ask your question. Please unmute your mic and ask your question.
Good morning, ma'am.
Good morning.
Ma'am, with regard to this non-communicable disease, what are the efforts that are made at the rural level?
Okay.
Apart from these ASHA workers, they are giving their best. I know they are giving their best, but what are the other efforts in the digital way that act in rural ways?
So, Farah, thank you for this question, first of all. And as I mentioned, a lot of work has already been initiated. And one of the programs that I talked about is definitely telemedicine, which is eSanjeevani, which is being launched by the Ministry of Health and Family Welfare itself, and trying to address to the unmet needs of the rural population. Besides that, there is also, I talked about the financial assistance programs that are being offered specifically to the people who are below the poverty line. And there are certainly, a lot of work that is being putting up in place through these ashas. And also, if you see, the transformation of sub centers to upgraded health and wellness centers is also one of the steps that has been taken by the Ministry of Health and Family Welfare. And also, which is one of the program, which is Ayushman Bharat, wherein, there is a financial assistance of up to, there is a health insurance for 5 lakhs, which is being provided to the family of, and these families have been identified based on the data which the government was already having. So all these are the provisions that are available for the rural population itself. So does that answers your query?
Thank you, ma'am.
Yeah, anyone else? Anyone else from the audience? Well, it was a really well-explained session. I don't think anyone else have any queries, ma'am. So we are immensely thankful to you, to Speaker Dr. Sikha Shukla for your efforts, ma'am, towards anchoring us today. Your innovative ideas and holistic approach explaining NCD in detail, especially the government programs which are not available like easily. It will prove highly beneficial to our participants, especially who want to pursue their career in public health sciences. CBOI need to mention its deepest sense of appreciation to you, ma'am. Before we wind up the session, I would like to make a little announcement regarding a CBOI journal. E-Avishkar. We at CBOI initiate a call for research papers in all areas of health sciences and technology, from original research papers, survey papers, case studies, any essay, and academic peer review articles. We welcome high quality of work that focus on research, innovation, and development in the Indian healthcare system. For any queries or any kind of, you can contact, all our contact details are being available on our website, www.cboy.in. I also extend my thanks to all the participants for the enormous cooperation for this session. So thank you so much, everyone, for joining us and giving us this opportunity to share all this holistic information with you all. Thank you so much, everyone, again, and have a great weekend. Thank you.
Thank you so much, Dr. Harmeet.
I'm Harsimran.